There we go. So are you going to share your screen?
Give me 1 second.
So she's going to ODU, and what degree are you seeking?
It's a master's in dental hygiene, so I'll be able to teach at university or any other schools, hopefully. I don't plan to teach right away. I plan to work first and then teach. So this is I'm only taking 1 class per semester, so I'm still working full time and taking classes, you know, just kind of easing it in and not doing everything at once so that I could still work.
And what advice would you have for the first year students that are going through what we're all going through right now? Because were in the middle of clinic.
Mm-hmm.
As far as they had just started seeing patients, they had spring break, and we have not been back. So they're going OMG.
I guess the best thing you can do now is just to make sure that you study really well and know all the content, since you're not really being able to see patients and you don't get that clinic experience. At least make sure that you know your content and you know, read up on materials and just get advice from other people on, you know, their experiences in the clinic. And I'm sorry that you guys had to go through this. I know it's not easy to just do everything from online. Misty, I'm gonna would you mind just to click next for me actually?
Oh, okay, all right. So what I'm doing is this, put us in this mode, and there we go. All right, so Wynn's just gonna say next every time we need.
Okay. All right, so first of all, we're gonna talk about tobacco today and periodontal disease as well. There's no such thing as safe tobacco. You know, smoking in any form is never good for you. The Centers for Disease and Control, they estimate that about 42.1 million people, that's 18.1% of adults that smoke in the US. And using tobacco can affect your immune system. It leads to many different types of cancers. It impacts existing health issues as well. And a lot of people know that it affects their health, but they don't really know that it affects their teeth. So it can contribute to a lot of dental problems. And this is where you come in. This is where you intervene as a dental hygiene professional. So today you'll learn about different ways that tobacco can affect the body, the gums, and the overall health. And you'll also be able to provide your patients with helpful information so that they can understand not only why they should quit, but also how they can quit as well. So said by the CDC, FDA, and I see these all over the websites, that smoking is the #1 most preventable cause of disease and death. And it harms nearly every organ in your body, and it's the most significant risk factor for periodontal disease as well.
Now, I'm just going to interject this. Their new Wilkins that they're using now, I don't know which one we had with you.
Oh, okay.
Consider smoking the 5th vital sign.
5th vital sign.
And they took that out.
Oh, okay.
The newest edition. So it was along with pulse, respiration, everything else. They took it out. I don't know why, but it is one of the most important questions that we do ask in our medical history that we're doing with patients. Okay, I'm muting again and.
Okay. All right, so we're going to talk about patient John Doe. He's a 70-year-old Asian male. He's a smoker for over 50 years. He's been smoking cigarettes. In 2012, he had a mini stroke, and he had high cholesterol, high blood pressure, and atherosclerosis, and all these conditions were worsened by tobacco. But yet he continued to smoke, so that didn't stop him. In 2015, he had some dental pain, so he came in the dental office, and he ended up having severe chronic generalized periodontitis. And I don't have an x-ray to show you, but he did have severe bone loss, and he had a full mouth rehabilitation. So they ended up extracting all of his upper tooth and then keeping some on the bottom and giving him dentures on both top and bottom. And in 2020, earlier this year, he actually had a coronary artery bypass surgery. So this patient, he's been told many times that smoking was bad, and he knew it was bad for his health, but that he didn't realize that it would ruin his gums and his teeth until he came in for the dental appointment. So these are the type of patients that can be very, very tough to change because they are addicted to tobacco. But with a little bit of help from you as a dental hygienist, just a little bit of intervention, some of these can be lessened or it can even be avoided as well. Okay, next. So after today's lecture, you'll be able to determine the health hazards associated with tobacco use. You'll be able to describe the components of tobacco products, explain the mechanisms for nicotine delivery, nicotine metabolism, identify the oral manifestations of tobacco use, signs and symptoms that you'll normally see in the mouth. Next. You'll also be able to recognize the effects of environmental tobacco smoke, ETS. You'll be able to evaluate and create an appropriate dental hygiene care plan for your patients that use tobacco and promote prevention, cessation using the 5 A's to help the patient that uses tobacco, and also to advocate drugs, pharmacotherapies, behavioral therapies for treatment of nicotine for your patients as well. Next. So tobacco is a health hazard. It's toxic. Like I mentioned, it's the single most preventable cause of disease and premature death in the world. Offsprings of smokers are actually more likely to become smokers themselves. There's a lot of systemic and oral health effects as well. The longer you smoke, the more negative effects you will get. And about 80% of women and 90% of men who die from lung cancer is related to smoking. Your life expectancy is shortened, so someone who smokes is living a lot less than someone who doesn't smoke. It can affect pregnancy, infant health, and once tobacco is lit up, it enters the air and it becomes environmental tobacco smoke, which is just as toxic to breathe in. So I'll ask you a question. Do you think that smoking just a little bit of tobacco is good for you? If you smoke in any amount, do you think that it's not bad for you?
People who smoke normally think that.
Yeah, so you're right. Any amount of smoking is not good, and it's considered a hazard. So any amount that you smoke is considered abuse. All right, so next. So components of tobacco products and tobacco smoke. Nicotine, it's the most addictive substance. It's very toxic. How addicted you'll become depends on the amount and rate of nicotine that gets delivered into your bloodstream. So that means how much and how fast the nicotine gets delivered into your blood. And there are a lot of cancerous substances. The most harmful is 1,2,3-butadiene. That makes rubber. Acrolein, acetaldehyde, cyanide, those are used in gas chambers. Arsenic is used in rat poison, and cresols, those are found in car exhaust. So basically, all of these items are very harmful to your health. When cigarette smoke is lit up, there's 7,357 chemicals, so a lot of chemicals, and the most harmful are the tobacco-specific N-nitrosamines, TSNAs, polonium-210, and carbon monoxide gas. Next. So nicotine, how it's absorbed is through your membranes, depending on what kind of tobacco it is or what form it is. It gets absorbed through your lungs, your skin, the oral mucosa, the buccal mucosa, and the GI tract. And the delivery depends on how it's taken, the amount, how much is taken, the depth, how much it's inhaled, the time, how long you inhale it for, and the pH. So that's the acidity of the smoke. And it's distributed through your bloodstream, and it reaches the brain in less than 20 seconds. So that's very fast, and it gets disseminated into your body tissues. It gets metabolized by the liver and excreted by the kidneys through the urine. Next. So smokeless tobacco, it's also known as snuff or chewing tobacco, could be moist or dry. It's placed in the mouth, it's not smoked. most harmful substance is the TSNAs, and it's absorbed through the gingiva, the oral mucous membranes, or sometimes when the tobacco juice is not spit out, but it's swallowed, it can get absorbed by the small intestine. And the amount of nicotine absorbed for the smokeless tobacco is 3 to 4 more times more nicotine than you get in a cigarette. So that's a lot more nicotine. Next. Next slide. So electronic nicotine delivery devices. These are also called e-cigarettes. There's no tobacco. Instead, it delivers nicotine that gets vaporized. And these are not approved by the FDA for safety or effectiveness. And the main concern is that they don't really know how much nicotine there actually is in a cartridge. That's not controlled. It's not recommended as a nicotine replacement therapy, so you can't use it as a replacement. And it leads to other tobacco products as well. So if you use like a vape, it also leads you to experimenting and using new products. So an example, and it's very popular among adolescents, is Juul. And also there's another one that Ms. D also did a CE course for called IQOS. That one, there is actually tobacco in it, but it's a heat, not burn. So you still get, the point of it is that you still get the tobacco taste and there's not as much vapor. Okay, next. So there are a lot of systemic effects. You get heart problems, lung diseases, cancer. It affects pregnancy, the infant health, other existing health conditions that you may have. It may worsen them, and also tobacco and the use of other drugs as well. Next, so we'll start with cardiovascular disease. Atherosclerosis is plaque buildup in the artery that causes a block of blood flow to the major organs. So you can kind of think of like a garden hose, and there's hard mineral deposits, and the water is trying to go through that hose, but it struggles to spray out water to the grass, the trees. And in this case, the grass, the trees are like your heart and your lungs. So it's not really able to grow and get the nutrients that it can. So when this plaque builds up so much in the blood vessel, you can get coronary heart disease, which is the block. And you can get pulmonary diseases as well, COPD, emphysema, chronic bronchitis, and also coronavirus as well. On March 24th, the World Health Organization, they actually said that smokers are more vulnerable to COVID-19 because of contaminated fingers, contact with your mouth, lung disease, reduced lung capacity, sharing hookah, and also breathing it in the air as well. There still needs to be a lot of research on this, but if you have anyone that wants to quit smoking, now would be a great time to quit smoking. Okay, so continuing, cancer. The leading cause of cancer in the US among cancer is lung cancer, and that's because of smoking. And oral cancer, 75% is related to tobacco use. So the more you use tobacco, the more your increased risk of developing cancer is. It can affect your pregnancy, infant health, ectopic pregnancy, sudden infant death syndrome, congenital effects, oral facial clefts like cleft lip, cleft palate, preterm births, low birth weight. Other health conditions, diabetes, rheumatoid arthritis, erectile dysfunction, blindness, and cataracts. And usually alcohol, those that combine alcohol and tobacco together, they have a greater risk for cancer and other oral problems. So we're going to talk about environmental tobacco smoke. There's mainstream smoke, side stream smoke, and environmental tobacco smoke. Mainstream smoke is the smoke that is inhaled directly into the lungs, and then you can also breathe it out into the air as well. Side stream smoke, let's say this is the cigarette, the side stream smoke would come directly from the lit end, and that would enter into the air as well. Environmental smoke is anything that gets put in the air. So it's also called passive smoke, involuntary smoke, secondhand smoke, and you've probably heard of secondhand smoke kills. There's also third-hand smoke as well, and that is the residue in the smoke that's left on furnishings, so like your chair, the floor, the carpet. And this is bad for children because also dogs and cats, because they spend a lot of time on or near the floor, and the tobacco smoke residue, it concentrates on the house dust, the carpets, the rugs, and then it gets on their fur, and they breathe in these harmful substances. They also can swallow them by licking themselves, licking their owner's hair, their skin, their clothes. So researchers at San Diego State University actually found out that as soon as someone quits smoking, it can last up to 6 months into their apartment. So that's how long that the ETS will stay in the room, 6 months, up to 6 months. Okay, next. So there's a lot of toxic chemicals in environmental tobacco smoke. 50 of 250 toxic chemicals are associated with cancer. You can get lung and respiratory effects, and exposure to all the smoke is the primary cause of the lung cancer, and you can get eye and nasal irritation as well. You can get similar heart effects as if you were a smoker, or if you were to breathe in the ETS, you can have similar effects on the heart. ETS is also a major preventable cause of heart disease and death, and increases your risk of stroke. So it can affect prenatal and children in the fetus. The nicotine and the carbon monoxide gas can actually cross through the placenta, and this can lead to miscarriage, placenta previa, low birth weight, preterm delivery, spontaneous abortion. There is a relationship between maternal smoking in early pregnancy that's related to oral facial clefts and ectopic pregnancy. And non-smoker mothers, even though they're not smoking, but they are exposed to the air, ETS, they can expose their unborn child to carbon monoxide, nicotine, and contamine. It can affect infancy. The nicotine can be transferred to your breast milk. It can increase their risk of developing upper respiratory disease and even have sudden infant death syndrome as well. In young children, it affects their physical health, their behavioral health, their mental health. They may be missing school more due to illness, asthma, wheezing, and the parental smoking influence is very strong. If they see their parents smoking, they are most likely to smoke as well. They'll think, oh, my parents are smoking, so it's not too bad. So they're more influenced to smoke. So when you see your patients, you'll see a lot of different types of oral manifestations if they use tobacco, and it depends, how it looks depends on the type and form of tobacco. So what type of tobacco they're using and how they're using it. And the pattern and severity depends on the frequency and duration of use. So that is how much you're using it and how long you use it for. And the best, most efficient, and most effective way to detect and start tobacco cessation is to do the EO-IO exam. Okay, next. So the next one is just a table from your book of the list of the oral consequences of tobacco use, and we'll go a little bit more, and I'll show you some pictures on the next slide. So verrucous carcinoma, this is usually seen with those that smoke, that chew the smokeless tobacco, and it looks like a red and white pebbly surface, usually on the side of the lip or even on the alveolar ridge. On the right picture, you'll see squamous cell carcinoma. This is associated with patients that smoke cigarettes, and the most common areas that you'll see it is on the side of the tongue and on the floor of the mouth. You can also have, can you go back one slide actually? Yes, so you can actually have a lot of periodontal issues as well. Severe periodontitis, you can have recession, tooth mobility, tooth loss, increase in pocket depths. Also, you can have necrotizing ulcerative gingivitis or periodontitis, which is punched out papilla. And these conditions are usually, there's usually an underlying medical condition. So HIV, AIDS, usually those weaken your immune system response and your ability to fight off periodontal infections. You can also see peri-implantitis, where you'll see in the picture the gum looks red and shiny, and when you touch the implant, it might be a little bit mobile. If patients tell you that they're bleeding a lot in that area, if they are flossing, and if you do have an x-ray, you can see that there's a little bit of bone loss in that area as well. So peri-implantitis is inflammation around the implant, and also it can lead to implant failure too, because you need a strong bone support in order to hold it. And someone asked me if I found any of these cancerous lesions in practice yet. I've actually seen one, but that was while I was temping, so I actually wasn't able to follow up, which I was planning on to do. I've also seen patients who already had oral cancer, so I haven't detected any that I know of just yet, but I have seen existing cancerous lesions in practice. So you can also see black hairy tongue, which they get that pigment, they get that dark color from the pigments in tobacco. Nicotine stomatitis, which is usually caused by cigar pipes, cigarettes that heat and burn the palate, and it's a little pebbly, it's white and keratinized and raised a little bit, and in the middle and the center it's a little bit red. Also, you'll notice, and I see this a little bit more often, smokeless tobacco keratosis in those that chew tobacco. They just leave it in their cheek and it creates this rough texture and it's a little bit white. I've also seen this, like a similar thing where patients would put like a crybaby or like a sour candy on the side of the mouth, and it would sort of look like this as well. So if you're never sure about the lesion or anything at all, just make sure you always give them a referral to send them for a biopsy, or just to make sure they check up on it. Okay, next. You'll also see patients that have a lot of dental stains, stains around their braces, stains around their restorations, stains around the margins of their teeth, and these are very difficult to remove. You'll also see that they have really bad breath. Okay, next. So with tobacco and periodontal infections, you have effects on the tissues, and we'll talk about how it destroys the tissues and your gum's response to the treatment. Okay, next. So the effects on the periodontal tissues, it's slide 26. There we go. You can have gingivitis, and you can actually reduce the inflammatory response. So this means that you'll actually have a lot less bleeding. So don't be fooled by patients that you see they have nice teeth, but then they have absolutely no bleeding, but they smoke. You know, this can fool you because smoking actually gets rid of it lowers your inflammatory response and your body's ability to let you know, hey, something is going on here. And with periodontitis, it can increase the rate and severity of the periodontitis, bone loss, clinical attachment loss, and these go hand in hand. Recession, pocket depths, they can be 5 to 7 millimeters, tooth loss, and when you increase your tobacco use, you kind of worsen the periodontitis. And it's when you decrease your tobacco use, you decrease the severity of it. And with periodontitis, you'll also see decrease in blood flow and gingival crevicular fluid. Okay, next. So mechanisms of periodontal destruction. There's actually no effect of the rate of dental biofilm accumulation. Instead, what it does is it reduces saliva. So when it reduces saliva, that can actually make it easier for bacteria to stick on the tooth, but it doesn't actually make the biofilm accumulate more directly. So host response, it lowers your immune system, it impairs your neutrophils, reduces your body's ability to fight infection. It has an impact on healing. It can delay your healing. It can make you not even heal at all. It can increase your risk of periodontitis. And this affects bone metabolism in women smokers. So after menopause, they usually have less bone density, less calcium deposits, and it affects the osteoporosis. So if they were to fall, it might impact them a little bit more. So that can be dangerous. All right, so their response to treatment is definitely weakened to any conventional therapy, SRPs, gum grafting, anything that involves gum healing, they'll have a negative impact on it. Also, bone regeneration, you'll see implantitis, implant failure, like we mentioned before, and delayed healing. So if your patients are getting an SRP, they're paying a lot of money for it. So something that you can tell your patients is that after they get the treatment, you want to quit smoking because you paid all this money, but it'll compromise your ability to heal. So we're going to talk about nicotine addiction, tolerance, dependence, addiction, and withdrawal. With tolerance, it's a physiologic adaptation. So you need to use more because it's not working as well. So if you have one cigarette, it doesn't really do as much. So you need more. You need to smoke 2 cigarettes. You need to smoke half a pack. Dependence is if you have loss of control, and it's the more nicotine that you get, the better you feel. There's more release of dopamine, so you get more pleasure. So that's positive reinforcement, is when you smoke, you feel good. You smoke, you feel good. And then when you stop, you get withdrawal symptoms. So that's the key point of dependence, is that when you stop using it, you'll have withdrawal feelings. With addiction, this is actually characterized as a disease. It's chronic and aggressive relapsing disease. And it's compulsive use of tobacco, even though you know it's harmful to your body. So for example, let's say like alcohol addiction. If you were to drink alcohol and you get a DUI and your doctor specifically tells you to stop and you lose your job, and you know that, so that is an addiction because it is clearly causing harm, but yet you still want to do it. And it's possible to be dependent and have high tolerance, but not be addicted as well. So I'll ask you a question. If a user smokes half a pack of cigarettes a day and they think they need more because they don't feel that high, what would that be an example of? So they need more, they need to feel more. Is that an example of tolerance, dependence, or addiction? So Kavneet said tolerance, and that is right. Yeah, so they need more to feel the high. So another question. If a user stops using cigarettes and they immediately start to feel withdrawal symptoms, what is this an example of? So they start to feel withdrawal symptoms if they don't use it. That's the key word. Okay, good answers. Amanda said dependence, and it is dependence because when you stop using it, you withdraw. All right, next slide. So treatment. Some reasons for quitting is health awareness, either general or specific health problem that's directly related to tobacco use, the effect on family. Let's say you want to be a role model for your kids or for the people around you, and you know of the effects of environmental tobacco smoke during pregnancy or on your kids, your pets. Effect on your wallet, it's expensive. Personally, I would rather buy food. I think a pack of cigarettes is about $5.25 in Virginia. And, if you smoke half a pack of cigarettes a day and you need that many weeks, it's a lot of money. Social pressure and restricted settings on smoking in many locations, that can also help give you a reason to quit as well. And personal recognition of knowing the dangers of nicotine addiction, that it's bad and that you want to gain back your self-control again of your life. So I'll ask you a question. Do you think stopping tobacco use after many years of smoking can even make a difference? What's the point? Will stopping now help? Yes, definitely yes. In fact, even 12 hours after you quit smoking, the carbon monoxide gas levels returns to normal. So that's good because you don't want carbon monoxide in your blood levels. That deprives your heart, your brain, and other vital organs of oxygen, which you need. All right, so self-help interventions. You can go cold turkey. Consider making some changes to your lifestyle with good diet and exercise. And this is probably really hard to do, to go cold turkey. You want to reduce the number of daily tobacco exposure. So let's say you smoke half a pack of cigarettes, maybe just smoke 3, maybe just smoke 1. Just reduce it so that, create a realistic goal for yourself and not do as much as you did before. Even decreasing that can help a lot. Over-the-counter nicotine replacement therapies, NRTs, recommend patches, gums, lozenges, and we'll go a little bit into detail that in a bit. You can have cessation with a family or friend. So it's a lot easier to go through this with a friend. So let's just say you go through a breakup with your husband or your boyfriend. If your friend goes through that same breakup, you guys both feel for each other. You know what each other is going through. They can help you. If you want to call your ex, they can say, hey, stop calling them, or they feel what you feel, so they can help you go through those challenges. So same thing with smoking. They know that you're going through those withdrawal feelings, and they know the pain that you're feeling and how much you want to just smoke a cigarette, so they can help you through that. Assisted strategies, counseling, social support, family and friends, have them around you, have them show support, be supportive of your journey to quit smoking. Pharmacotherapies, the drugs that you can use, or you can have a combination of both. So counseling with pharmacotherapy, it's been shown to be more effective in quitting than just doing counseling by itself or pharmacotherapy by itself. And about 1/3 of smokers actually try to quit, but only 2 to 3% are successful. Oh, you're good. You can go to the next one, Ms. D. All right, so the whole point of the pharmacotherapy is to make it easier to avoid tobacco, basically partially replacing the nicotine or counteracting its action so that you don't go through those withdrawal symptoms. Sustaining tolerance by somewhat giving you a little bit of nicotine so you can fulfill the craving, so you still get some effects from it, and to reduce the pain that you get from the withdrawal symptoms. So to consider, try to discourage casual use. So you don't want someone to use the nicotine replacement patches, just as they please, because using the methods improperly, and if they fail to use it, if it fails to treat their nicotine addiction, it can actually prevent them from trying to quit in the future. Inform them of the nicotine overdose, nausea, dizziness, rapid heartbeat, indigestion, heartburn, things like that. And also consult your primary care physician if there are a minor or if there's contraindications that are present, like if they have an underlying medical condition. All right, contraindications. You don't want to self-medicate unless you have professional advice, exam, or consultation. If you are pregnancy or breastfeeding, you have to remember that nicotine in the bloodstream can actually cross the placenta into the fetus and harm them that way. When you're using the nicotine gum or the lozenge, you have to be careful if you have hypertension, if you're using meds for asthma, diabetes, cardiovascular disease, and stomach ulcers. With the nicotine patch, you can have an allergy to the adhesive. With the nicotine inhaler, you can have a menthol allergy. And with the gum, lozenge, and inhaler, you want to make sure that you avoid eating or drinking acidic beverages for 15 minutes before and during use, just to prevent the too much nicotine absorption. So nicotine replacement therapies, these are the patches, gums, lozenge, the inhalers, and nasal spray. The purpose of this is to help prevent withdrawal symptoms, to promote you to quit using tobacco, and to make sure that you don't really relapse and it's less likely to cause dependence. So this is a chart, like a summary of the NRTs. Nicotine patch is transdermal. So you want to put it on your skin and you want to place it on a place that doesn't have a lot of hair. So if you have a lot of hair, you can shave it off or find a place that doesn't have a lot of hair and try not to cut the patches. You know, it won't work that way. Just because you cut it in half, you can have some of the nicotine leak out, and that way it's not really controlled. With the nicotine gum that's transmucosal, that goes into your mouth. It goes through the mucous membranes. It's not like regular gum, so you want to make sure that you remember to chew the gum and then park it in the vestibule and then repeat. So you chew it, you park it, and until you get like a peppery or tingly taste, and then chew it again. And you want to do that for about 30 minutes to an hour. With the lozenge, you dissolve that in your mouth. You kind of just keep it in your mouth to dissolve it. You don't bite it, you don't chew it. Because that can actually increase nicotine absorption too. You don't want nicotine to be absorbed too fast into your system. And usually these are sweetened with mannitol and aspartame. Nicotine inhaler, that's also transmucosal. It's released in the mouth when you puff it, and you don't want to swallow it and don't inhale it because that can cause irritation. Similar with the nasal spray, that goes to your nose, the nasal mucous membrane. You spray it in your nose and you tilt your head back and kind of just let it drip back and try not to breathe in too much because that can also cause irritation as well. So I'll ask you a question. Can you cut the nicotine patch in half or in smaller pieces? No, you are right. You cannot. Bottom line is you could potentially overdose on nicotine or poison yourself if you use a cut patch because you don't really know how much nicotine you're really getting. Another question, is nicotine gum simple to use because it can be chewed like regular gum? Correct. It's not to be chewed like regular gum, similar, but you have to remember to chew, park, and repeat. Chew, park, repeat. Okay, next one. All right, nicotine-free therapy. These are therapies that don't have nicotine in them. So bupropion, that is to block neural uptake of dopamine or norepinephrine. So basically it helps you quit smoking by reducing your cravings and reducing the withdrawal effects. And examples are Zyban, Wellbutrin, those are FDA approved. You also have varenicline tartrate, that's a partial nicotine agonist. Because it's partial, it blocks nicotine receptors and it still reduces it still has a little bit of dopamine release, but it reduces the dopamine release. So it mimics the action of nicotine on the brain, and it can help in easing nicotine withdrawal symptoms and kind of wean you off of it slowly. An example is Chantix, and that's FDA approved as well. Combination therapy, so you can use the nicotine patch along with the gum, the nasal spray, the inhaler, and the bupropion drug. So remember, the nicotine patch is actually slow release. So that's why you can use the patch with the gum, spray, inhaler, or the drug. But you don't want to use the nicotine gum with the lozenge because those are both basically to reduce your cravings. So it will give you a lot of nicotine all at once. You want something that will slowly give you nicotine and then give you a lot of nicotine to suppress your craving, but you don't want too much nicotine because that can cause heartburn and indigestion. Second line medications, these are not FDA approved and those treat tobacco dependence. All right, so dental hygiene care for the patient who uses tobacco. Every time you take a patient history, you want to make sure that you document at each appointment the types of tobacco they use, how long they've been using it, what do they use, and their alcohol use too. And in my book, it said it was a possible vital sign, but I guess the updated is that it's a fifth vital sign along with blood pressure, pulse, and breathing as well. So when you do your EO-IO, for the EO, you want to take a look at their breath, their body odor. Usually when someone passes you, can kind of smell it off of their body. You can smell it on their hair and their breath. You can see, take a look at their fingers and fingernails. They'll have something called smoker's fingers, where it kind of stains it a little bit yellow in their fingers and their fingernail. Also, their skin. Take a look at their skin on their face. Smokers usually have premature facial wrinkling, and also their lips as well. People that smoke pipe or cigars, they're more at risk for developing precancerous and cancerous lesions. So intraoral exam, you want to detect the lesion or the problem. So you want to show them, you want to explain it to them, and then record it. You want to show the patient.
You can learn not my stuff about your
You can show the patient the condition, explain the consequences or how they received it and what will happen if they continue to smoke, and also record the full detail of the problem. So take a picture of it, measure it, and take note of the characteristics of it.
Figure that out.
I haven't figured it out yet.
So referral indications, you want to make sure that you buy them.
I apologize. I'm going to interrupt. Please mute. Please mute.
Of electrochemical energy with chemical energy. Louise, yes, we do. We're going to meet first and then break off into the test, okay? All right. So,
Miss D, there might be a way to mute everybody.
I don't know where it is. I know there is, but hold on. I'm going to stop, pause the share.
and certain things have to happen. Energy is going to be released by a spontaneous reaction.
I don't know where to go. So anyway, I'm going to, I hear Heather, so I think that
Or we
I'm
use
gonna text
electrical
her.
energy.
when I am so sorry.
It's okay.
This
I
is
think
my,
it's Taylor. I think
Everyone's saying Taylor.
yeah, Taylor's unmuted.
oh,
Trees are not my friends this week.
okay.
Electrons then are transferred from one substance to another substance, and that's the whole crux of
At least she's learning.
redox, is the transfer of electrons.
No, they
One
have sat through some
atom or
horrible
molecule is
things
giving
with
up electrons.
Oh, okay.
trying to figure this out.
So if we look at a reaction that we're familiar with, if we take magnesium metal,
Thank you. We're good.
Okay.
You don't have to turn this into your instructor, do you?
No, not the PowerPoint. Just the lesson plan. That's for me to watch again and be able to
Okay.
grade myself.
Well, then you can blame this stuff on me. I'm going to mute myself again.
Okay. All right, so I'll continue. So biopsy, you want to make sure the patient that they have a lesion, that they go and get the results and actually go there. Because most of the time when you refer a patient for a consult, they don't really go or they forget. So you want to make sure that they go and get the results, and you want to consult with the pathologist, and whatever the results are, you want to document it. And oral self-exam. This is very important, especially in this high-risk group. You want to teach them how to do the same EO-IO techniques that you do in class and in lab. You want to teach them how to take a look at their mouth, see if there's any abnormal or suspicious lesions. And similar to above, detect, relate, and motivate. So you detect lesions, you point it out to the patient, you let them, give them a hand mirror and show them. And this is good for motivating them to quit because they see the problem. And right when the patients see that the problem goes away because they stop smoking, or the periodontitis goes away because they stop smoking, that will really help them quit and permanently for good. Someone says, has anyone seen the TikTok where the student yells at his mom for making whole class noise during his lecture? I haven't seen that, but I have seen the one where the lady takes the laptop to the bathroom, and that one was relatable. So don't be a victim of that. All right. I still had a little bit more on the last slide, but I'll just go through it real quickly. You want to refer them to a primary care physician for patients who don't usually seek medical care. you always have those patients that come in and say, oh no, there's no problems with me. I'm perfectly fine. I'm perfectly healthy. But did they ever get checked out? You know, they could have some underlying problems that they may not know of. And especially if they smoke, they definitely should get checked out for underlying medical problems. And it's important so we can plan the dental treatments accordingly. Okay, next one. So patients in your dental chair, you'll notice that they may have increased risk of dental stain, calculus, dental caries, or periodontal problems. So you might need a little bit more appointments because of this reason. Next slide. You want to make sure that they are on top of their oral hygiene. You know, you want them to be perfect with their oral hygiene if they smoke or if they use tobacco. That's their first priority because they are very highly susceptible to caries, periodontal infections, and soft tissue changes. With non-surgical periodontal therapy, they will have poor healing if they continue to use it, and if they stop using it, it will definitely improve. And just consider and be cautious when using power-driven instruments, so like air polisher or the Cavitron. Smokers usually have lung and heart issues, and these aerosols can have bacteria and debris. Other patient instruction: proper diet, exercise 30 minutes a day at least, good nutrition. Also, most of smoker patients are usually poorly nourished. They have decreased appetite, so they may not be eating properly or eating as much. And just remember that some people actually use smoking as a way to curb their appetite and to lose weight. So that actually may interfere with their willingness to do the tobacco cessation. And smokeless tobacco is usually sweetened, so you want to be able to recommend them like fluoride or other treatments as needed. So with the dental hygiene care plan, tobacco cessation is an important part of it. You have to know that it'll take multiple appointments. You know, they're not going to stop right on the spot. You'll need to repeat it a lot of times, but you want to repeat it in a way that doesn't really make them feel too forced because they can respond poorly that way. And it'll take them multiple attempts to quit. They probably won't get it on their first time. And majority want to quit. They need to, and a lot of people, 1/3, are willing to try. And even just a little bit of intervention, if you intervene just a little bit, the outcomes will vary. So that depends on your experience as a clinician and how motivated you are to tell them to stop. You know, if you're someone who says, they're not going to stop, so I'm not going to say anything about it, you know, that will definitely affect their willingness to stop tobacco, because then they'll be like, oh, she didn't mention it this time, I guess it's not really that important. And it also depends on their willingness to stop smoking as well. So, and how well they are willing to stick to quitting. And so you can help with tobacco cessation in that way. Okay, next. So chapter 26 has useful information on behavior change discussion. It'll tell you how to go from state of unawareness to awareness to change the patient's behavior. So you want to take a look at that. That's chapter 26. And we'll go into the 5 A's. So ask, advise, assess, assist, arrange. So ask, you can go on to the next one. So every time they come in, you want to ask them their health history, their tobacco use. If you're using tobacco, if you're not using tobacco, what kind of tobacco you're using, how much do you use, how often do you use it, and for how long. You want to present the questions carefully and be non-judgmental and address it more of as a health issue and not really say, oh, you smoke, that's not right. So you want to say, oh, it's bad for your health. You want to approach it as that kind of issue. You want to obtain the patient's confidence. A lot of minors, they might not really tell you that they smoke, so you want to make sure that you obtain their confidence. And ask them if they have children or adolescents in the house, because the ETS can affect them and it can be a bad example for them as well. So you advise them. So you tell them, the people who never smoke or the people who smoke before, you say, good job for not smoking. Again, repeat why it's good for them to stop smoking and the benefits of it. But if they still smoke, you want to stop, show, and listen. So you tell them to stop now in a very caring and compassionate way. You show them what's in their mouth. You know, you say, hey, this is a lesion that you got from chewing tobacco. And you tell them how it's related to tobacco use. You know, it could possibly become cancerous and things like that. And you listen to them if they want to quit. Some people are not ready to quit, and some people do want to quit, but they find it hard to quit. So the next step is to assess. So are you willing to quit? You see how willing they are, how ready they are to quit. If they are willing to quit, great, you can go to the next step. If they're not willing to quit, you review the 5 R's. That's relevance, risks, rewards, roadblocks, repetition. And these are, the patient has to explain to you the relevance, the importance of quitting, so that they know why they should quit. They know the risks. They know the negative consequences, what will happen if they continue. They know the personal benefits, the rewards, what will happen if they stop. They know the roadblocks, you know, what is keeping them from smoking. They have to identify those barriers, and hopefully as a clinician, you can help them overcome some of those barriers and to repeat it and reinforce the motivation at every single appointment. So these 5 R's are basically for the patient to tell you, I still smoke, I'm not ready to quit, but I still know the reasons why I should quit. So if they are ready to quit, then you assist them, you help them, you establish a quit plan, hopefully and preferably within 2 weeks, and you provide practical counseling and provide pharmacotherapy, so you can suggest over-the-counter NRTs, and you can suggest a combination of both counseling and medication, which has shown to be more effective. And also let them know what to expect for the withdrawal symptoms, because they will probably not expect it to be that hard. That's very important. And next step is to arrange. So you arrange a follow-up. So they've already established their quit date, so you want to follow up to make sure if they're actually, you know, quitting, if they're following, if they've relapsed. You want to call them by phone, email, or check up on them if they have an earlier appointment. If they do stop, congratulate them, praise them, you know, make them feel good, make them feel like they've succeeded. But if they relapse, which is really common, you want to recall reasons why. You know, what are the reasons why you relapsed, and you want to record this and document it so that next time they come, maybe you can give them advice for how they can quit smoking as well. And this is just a tobacco cessation flowchart that you can take a look at in your book. And the next slide is just a summary of all the ask, advise, assess, assist, and arrange. You can take a look at that as well to help you study. The next one is the team approach. You want to organize the team clinic. So dental hygienists, believe it or not, are actually more, they tell you about tobacco cessation more than the actual dentist does. So it's very important that we get the whole clinic team to work together to contribute to the tobacco cessation. You want to organize a tobacco-free environment, remove all the ashtrays, put up thank you for not smoking signs, and you can have help from your front desk do this too. You want to display tobacco information, educational materials, and and also eliminate tobacco ads as well, like magazines, you know, any of the magazines that praise or idolize smoking. You want to organize a tobacco user tracking system. There's a tobacco assessment form in your book, and also progress report notes. You want to write notes on what you told them how to quit, their responses, their interests, their progress on quitting. You want to record the tobacco status on the chart or on the electric chart so that it can easily be seen by the dentist, so then they can intervene as well. So advocacy, this is important as well. You as a dental hygienist, you have a lot of impact, and you can advocate and you can make a difference too. The US Surgeon General, they put out a report on oral health saying that tobacco use is a risk factor for mouth and throat cancer. Healthcare providers can promote tobacco cessation to communities. So you can do this by when you go out and volunteer in nursing homes or adolescent areas. And while you're telling them about their oral health and how to brush and floss, you can also tell them smoking plays a role as well. So that's how you can advocate for tobacco cessation to communities. Also, smoke-free workplaces have been, the signs have been put up to not smoke in these places. And know that you as an oral health professional are very valuable in this. Community oral health educational programs. There's a lot of nonprofit organizations that have tobacco cessation materials that you can get online and that you can give to your patients as well. So documentation, always document, document, document. This is very important. You want to make sure that it's careful and complete. You want to make sure you write down the history and the current use, how much tobacco they're using, if they've used it, how many years, what kind, how much, how long, their age, ethnicity, and gender. So like 70-year-old Asian male, their periodontal and overall dental status, if they have periodontitis, gingivitis, hopeless teeth, oral cancer screening, if they have any lesions that you noted, patient interests, their motivation and readiness. This is if they want to smoke, if they're motivated, if they're ready. And options for cessation, as a dental hygienist, you can recommend those over-the-counter NRTs and also pharmacotherapies. With the dentist, you guys can both kind of discuss options for the patient. And any referrals that you have made for them to get checked out for any lesions that they have, you want to note that into your documentation as well. So these are the key points to teach the patient. The best way to start tobacco cessation basically is to never start. Hopefully you won't ever have to worry about it. Regular self-examination, you want to teach them the tips and tricks of the EO-IO exam. Know that pregnant women who use tobacco, they can harm the fetus and the infant, and young children are more likely to experiment, and parents should be educated so that they can have that discussion with them. Parents are huge influences of children, so if they smoke, most likely the child will smoke as well, so that's something to consider. All forms of tobacco use, that can possibly lead to addiction, even if it's social or just a little bit of tobacco use, it can definitely lead to addiction. Even non-smokers who breathe ETS and children, they can have the same health problems as someone who actually smokes. So that's really dangerous as well. Smokeless tobacco is not a safe alternative to smoking because it does absorb nicotine 3 to 4 more times more than a cigarette. So you can't use that as an alternative to smoking. And oral health team members, you guys can play a huge role in advocating and legislation and public health policy. This is important so you can make informed choices about contributing to the dental hygiene smoke-free society. All right, so we'll go back to patient John Doe. So this is a picture of how his teeth were. He had the severe periodontitis, bone loss. So the second picture, he actually had the entire top row extracted and a full denture put on. The bottom row, he had some tooth extracted, but he didn't really have the funds for implants. So he decided to keep the good roots, the root canal roots, and then add some zest locators on it. And these zest locators, it attaches the denture so that he can actually remove it. He can take it off and brush his teeth roots. And that was a better alternative than implants because we knew that his oral hygiene wasn't good and that he may continue to smoke. So that was a better option for him. And he was actually very satisfied with the results. So I'll ask you a couple questions about him. So earlier he had a stroke, but yet he continued to smoke even though the doctors told him to quit. What tobacco abuse is this an example of? Nicotine tolerance, nicotine dependence, or nicotine addiction? Yes, addiction, because it's he knew that it was harmful to his body, yet he still did it. So when the dentist told him that he would have to get his perio under control and quit smoking, do you think that he actually quit smoking or do you think he continued smoking? Yes, so he actually continued to smoke socially and every now and then, but earlier this year, he had to go through coronary artery bypass. And that surgery is to restore normal blood flow to an obstructed artery. So like the hose is obstructed, can't give water to the plants. And this is actually when he finally decided to quit. No second molars on the denture, is that typical? For him, he didn't have any on the top, so they just matched it. Is it typical? I'm not sure. It may have fit his mouth better that way, since it probably contoured to his mouth better that way. No problem. So we'll go on to the next slide. So yeah, this is actually my uncle. He was smoking for so long, and then even though all those bad things happened to him, he finally stopped after the last straw, the coronary artery bypass surgery. And this was right before all the COVID started happening. So he was actually still in the hospital, and we couldn't visit him because of that reason. So I hope that you'll understand that tobacco dependence and addiction, it's very, very hard to overcome, and realize that it may need multiple appointments, repeated interventions, and multiple times to quit. You know, they won't quit on their first time, but you have to keep trying. But as a dental hygienist, you are in the perfect position to be able to help these patients, give them education and insight, and you can be the reason why someone quits smoking today, hopefully. Yeah, and good for him, because he stopped.
Is this your last slide? This was your closure?
We have, yes, that was my last slide. We still have a critical thinking activity.
Oh, sorry.
Some of these may be on your exam, maybe. All right, so Mary Jane is a 32-year-old woman who recently just quit chewing tobacco. She recently bought nicotine gum from the pharmacy in order to aid in smoking cessation and to manage cravings. She returns a week later with complaints of heartburn and indigestion, and these adverse effects are disrupting Mary's workday, and she asks you for advice. So what can you tell Mary about why she has heartburn and indigestion? So she was quitting chewing tobacco, and she bought some nicotine gum, and now she's feeling heartburn and indigestion. Basically, she wants it to stop. So what can you tell her why she has heartburn and indigestion? Anyone? Just any guess is fine. You guys are so smart. Yeah, so she's actually chewing it too fast. And when she chews it too fast, it goes into her saliva, and then it goes into her stomach. So you want to remember to chew, park, and repeat. So not chew, 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 but chew, park, and repeat. So yeah, you guys are both right. So I guess that answers the next question. What direction should you give Mary on how to use the nicotine gum correctly? You want to chew, park, and repeat. So the next question is, you notice a white patch on Mary's left cheek, and she didn't notice it before. What should you do next? And Ms. D, can you go to the next slide? Yeah, so you notice that white patch, and she didn't notice it before. So what should you do next? Yes. So you should definitely document the lesion, take a picture, kind of describe it, the size, and send it to referral for biopsy. Because if you have any kind of confusion of what it could be, you definitely want to send them for referral, because she did say she quit. So if she quit, ideally the lesion should not be there. You want to make sure that she monitors it. And if she didn't quit, you might want to continue talking about tobacco cessation. But since she is already willing to quit, she might just need kind of like a extra help, maybe some materials on how to proceed. And you want to relate the lesion to how smoking can cause the keratosis and leukoplakia and it worsening as a risk factor for cancer. You want to show her how to do the self-EO-IO exam so that she can monitor the suspicions in her mouth. And also you want to tell her that she can't smoke or she can't use tobacco while using the gum. So she can't be doing, both at the same time. She has to quit smoking or using the tobacco and then use the NRT. But if she actually she actually quit using the tobacco, then definitely refer her for a biopsy because that shouldn't be there.
Do you notice the hair on her lip? I love it. That's me under quarantine.
Do you notice the food in her teeth?
Well, that might be the smokeless tobacco too.
Could be food, could be stain, I don't know. All right, but that concludes the presentation. Does anyone have any questions?
And I don't know how to unmute everybody. So you're going to have to type them in, please.
They've been using the chat, so I think they've been doing a great job.
Yeah.
They're probably in their PJs, no makeup.
Well, I am.
No hair done.
I was still up at 4 a.m. this morning. So when I looked at the clock, it was like, holy cow. So I'm still in my PJs. Any questions? When is realizing, because she had to do lesson plans and everything else, the arduous.
It is no joke. I have so much respect for educators. It's so much to create a lesson plan, especially from scratch too. But you definitely helped out a lot, Ms. D.
Oh, well, no, well, you're welcome for that. But I was telling her also that we don't do that in real life.
Yeah, that's true.
This is an important chapter. The board reviews always do the 5 A's. Now, I don't know, did you have any questions on tobacco cessation when you were, or tobacco use when you did your boards? Do you remember?
When I did my boards, I know they mentioned a lot about the 5 A's. They talked about nicotine absorption. See, they talked a lot about like the heart conditions, the lung conditions, cleft lip, cleft palate, things like that. And someone asked a question, how would you approach a family member to help them quit if they are not ready? This was my uncle, hands down. He was in the Vietnam War, so all they did was smoke and use their teeth for everything. So basically what we did was just keep telling him, keep telling. Some people, yeah, it is harder to take them more seriously. But I think the more you tell them, and some people respond to advice differently. In my uncle's case, I think he needed to be scolded, to be honest. It's hard to be nice to everyone, especially if they're not taking you seriously. But you definitely want to start out being, kind, compassionate, and kind of see how it goes from there. Use your judgment, see how they respond to you. And if your family is doing it, it's really hard. It's really hard. And you just sometimes it has to be from them. But I think definitely giving them information about it that they might not know of can definitely help, because my uncle didn't really know that it can affect his teeth. He was smoking a lot before, but when he got his teeth fixed, he was a little bit more motivated to stop smoking because he loved his teeth so much. But then when he got his coronary bypass surgery, that's when he completely stopped. So everyone has different reasons why they stop, but I think giving them a little bit more information on stuff that they don't know can really engrave it in their brain a little bit more.
And I think we also need to be cognizant of where our particular patients grew up. Some countries, smoking is more tolerable.
Yes.
And I know years ago, especially Europeans hated coming to the United States because we were cracking down on smoking, and they were really taking it as a personal affront that they couldn't smoke like they usually do. But now it's a little better with that, but culture has some to do with it. My mother smoked through 5 pregnancies. This was the 50s. She drank through 5 pregnancies as well. And our formula happened to be K-Row syrup and concentrated carnation milk. I turned out fine. That's questionable, but I turned out fine. So as we know more, even the e-cigarettes are getting such a bad rap with the popcorn lung and everything else that's associated with it, that's not even a good alternative like it was being advertised initially. So my question is to the class, has anybody been successful in stopping to smoke? Sarah Bruno says ADHA has a good CE on vaping. Yes, and I took a 3-hour CE during scientific session a couple weeks ago too, but has anybody been successful with this? I can relate with the dieting. You've seen my weight go up and down and up and down, and it's those steak and cheese subs, you know, and then the French fries get added into it. So it is very difficult.
Yeah, it's difficult. It'll take years. And someone says that they keep sending him pictures of nicotine teeth from the textbook and harassing him. Some people are motivated in different ways. Like I know some people are motivated because once they told them girls won't like you if your breath stinks, and then that actually helped them stop. It's like they care more about what other people think of them than how they are with their own health. So it's different for everybody.
Are there any questions? Now, I emailed everybody last evening the rubric for
Yes.
and along with your email. Do you have any instructions before we close?
Yeah, so I'll just need it within the next 3 days. If you can send it as early as possible, that would be great. And this is just to let my teacher know how I'm doing, how I'm lecturing, and it'll really help me with my profile. So if you can send that to my email or Mrs. D's email, that would really help me out a lot.
Okay, and I did give you her email, UMA002
Yes.
at ODU.
.edu.
At ODU.edu, yeah.
Yes.
Okay, so if you need that sent out again, I can do that.
Okay. And I'll email you later, but thank you so much for giving me this opportunity to present.
Thank you.
And good luck to everybody. I hopefully this thing will eventually be over and you guys will be able to practice again.
Oi, 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 yes.
Oh, I wanted to mention that I think, Ms. D, you told me I was the only student with 3 quality points at the end of 142, and that was the all-time low of all the students. Because I spent 8 appointments on difficulty 1 patient because I was so, like, I really wanted to be perfect and everything, but when it comes down to it, it's the quality points that matter.
Yes, and they got side railed with this this COVID thing. So everybody's getting a grace period. We just don't know when we're going back. They have deemed we're doing distancing through the summer, but we don't know when we are going to be allowed back on campus so they can start where they left off. Unfortunately, it's a big step backwards. But again, be grateful that you're not the second year waiting.
Yes.
So thank you very much. You have Wynn's email, so even reach out to her if you have questions about pursuing extra education or private practice questions, that type of thing. We appreciate your time.
Thank you. Thank you, everyone.
Bye.
Bye-bye.
Okay, and before the class goes, I'm not going to do the orthodontic chapter. I will excuse me, I will record that. The big thing with the ortho chapter is when you're removing brackets. I have never removed a bracket, but you don't twist. And that's the only thing I've really, with the little clamps, because they've got the bracket bond on. So you take it and you clamp it, and you don't want to twist it off because you could actually fracture the tooth. That's the only question I've ever seen on any boards, released boards, on removing ortho. But I'll be recording that later on this afternoon. I am going to be talking to Heen in a few minutes. We have a date because she evidently is going to be doing a review for you all as well for the upcoming test. So I'll be reviewing with her so she can review with you. And are there any questions? I have like 30 emails I see that have come through. So let me know. And I did for Perio, everything is up and reported. So that I think is up to date. I'll do the ortho chapter this afternoon. And Heather and Sarah are in charge of letting me know when exams are going to be. All right, so on Thursday, we have a presentation, and I'm going to be with group 5, and I will also need to know from group 5 and the group, you all, that was part of the charge on when you want the review done. So there might be a little bit of wiggle room there as well. Any questions before we sign off? When is the next 142 exam? It's slotted for Monday, the 13th. Don't forget, if you have any CE that you still need to do, the deadline is for that. And that is for Monday. You've got 3 CEs that are due for you.
Misty,
Yeah.
I'm looking at the email that you sent last night. Is that the one that you said has the evaluation for when?
It should.
I don't see it attached. Could you send it? And also, I don't see her email.
Okay, then, so I will email the form and email to everybody.
Yes, please. Thank you.
Yeah, thank you. This is very nerve-wracking for students to have to do it, as you can appreciate after doing,
Oh, yeah, I know.
doing some presentation. So I will get that out to the class.
Thank you.
You're welcome. Any other questions?
Misty, your email you mentioned is backed up, but I do have an update on the Perio exam if you would like me to make that announcement, or if
Sure.
you wait for your email. Okay. The group has decided that they would like to complete their review on Thursday, and the class has voted, and it looks like Friday came in as a landslide.
So Friday, okay, so I will open the exam on Friday. That's this, is that this Friday?
Yes, ma'am.
Okay, all right, very good. It'll be open from 8 until whenever, 11:59. That's easy to do. Okay. Any other issues? I thank everybody for your patience, especially with me and technology. And oh, Shanita, so many tests. Yes, welcome. Well, at least last year I was having all the exams. Everybody was taking them all at once. They were on the computer, but there was no wiggle room because we were in the open computer lab. So at least this year you've got it easier than previous years as far as that goes. So there's a little bit of a silver lining for you all. So, okay, that is going to be it. I'm going to stop the share and we will abort this session, go out and make it a good day.